Hi, I'm Santa Clara County Supervisor Dave Cortese, and welcome back to another Saturday COVID-19 update here at the Viet Bay Studios. We are so grateful to Viet Bay for donating this beautiful studio space that they use for charitable broadcast purposes, and they've been nice enough to allow the county, just as a charitable gift on their part, allowing the county to have this time so that we can bring people in and talk about the progress or not with COVID-19, what the current state of affairs are. Things are changing so quick. At first we wondered whether or not we'd have a lot to talk about from week to week, and then we realized we have a lot to talk about just about every hour of the day. So things keep changing. I always kind of open up by letting people know what some of the main indicators are that have changed over the past week. But right now I'm going to take this mask off. I was talking to our guest, Dr. Sarah Rudman, who I'm very, very grateful to have on with us today, because she is the Assistant Health Officer and Director of COVID-19 Case Investigation and Contact Tracing. So she's right in there with Dr. Cody. People are sometimes, I think, feeling like they wonder if they have access to the public health folks. And you do have access today, but Dr. Rudman specifically said, and I learned something new today, it's a good idea to start off and let people know when we're on a broadcast that we're wearing the mask, that we come in with the masks on, and only until we've separated 6 feet apart, which we have today, do we take them off. So I'm going to take mine off now and continue to give you a few factoids just about the past week. Tragically, deaths is something I always mention right at the outset of these Saturday programs, not because of any particular fascination I have with it, just because I think it's really important to acknowledge that there are folks dying from the disease, COVID-19, that's caused by the coronavirus, and that 183 people just in these few months since March 16th have already lost their lives. Maybe a few of them before or after that date, but the point is, we are still losing people from this disease, and that's in a county that's really done a great job of keeping the impact of the virus down. Nationwide, those numbers are really huge. We have 173 people hospitalized as of yesterday here in Santa Clara County, and if you've been checking in here from Saturday to Saturday, you know that number is much higher, about 3 times higher than it was just about 4 weeks ago, maybe 3.5 weeks ago. So that's not a good sign, and that's something we're going to talk about today. Is what happens when those numbers go up? What kind of pressure do we get from the state of California and even from our own public health department? In terms of what we need to do next. I want to say that testing is up. We're going to be talking specifically about sort of testing, but what happens after testing with the contact tracing. Since we were here last, we have conducted 42,480 more tests. Yes, you heard that right. Just since last Saturday, 42,480 more tests in Santa Clara County. People were asking us, calling in, as you can imagine, just a few weeks ago, saying, when are you going to get testing up? When is testing going to be as robust as the CDC wants it, or the state wants it, or as Dr. Cody wants it? The Board of Supervisors has certainly backed up that investment, and of course the Public Health Department has just done a very rigorous job of using every kind of testing possible, pop-up locations, and roving around and going to homeless encampments and going to congregate care facilities and making sure it's free to people and it's quick and easy. But we'll talk about that some more. Right now, I want to introduce Dr. Rudman, and let me say a little bit more about her. She used to work at the California Department of Health before joining us in Santa Clara County in our Department of Health here. She's been with our county since 2016 as Assistant Public Health Officer, STD HIV Controller, and Medical Director for the county's Municipal STD Clinic. She's also a Clinical Assistant Professor at Stanford University, where she's affiliated, and she trains residents and infectious disease fellows in sexual health care. Since the beginning of this pandemic, she has played various leadership roles in the county's response. She's currently, as I mentioned a few minutes ago, director of the county's case investigation and contact tracing program. She's going to explain contact tracing for us a little bit more, but probably more importantly, she's going to help me answer your questions. Lots of you ask very, very specific questions. We like that. We want that to happen, and I always enjoy when we have someone here who can give you very specific responses back. And if either of us has trouble answering your question, you can see website URLs, you can see phone numbers on the screen. Those are available to you, especially if not on the weekend, first thing Monday morning. Feel free to call my office and let us know if you have a follow-up question. With that, I'm Dr. Redmond. Thank you so much for joining us on a Saturday afternoon. We know you've been spending your life in the Emergency Operations Center. I don't know if it's a relief to get out of there for a little while and be here, or if it's just one more burden. But thank you in any case for being here today. Maybe you could self-introduce a little more and just let people know, what you've been doing.
Sure. Well, I'll also take my mask off, since, as you said, I wear it every time I leave the house, all day, every day, since I do have to still leave the house for my essential work. But since we checked and we're exactly 6 feet apart today,
Yep.
And we're making an exception so that the listeners can make sure they can understand what we're sharing. Exactly as you said, my background is in, I'm a physician in adult infectious diseases. My previous work before focusing on sexual health with the county was in general infectious disease outbreak response with the state.
Right.
And that set me up nicely for exactly what we'd always prepared for but hoped would never happen, to respond to this type of pandemic. So since the beginning of the county's response, I've had a number of different roles, but most recently I've been really honored to have this role leading the really impressive case investigation and outbreak contact tracing response that the county has done. I think some of what's striking is how we have expanded to a workforce that no one in California, to a scale no one in California has really been able to achieve. And that's really come from the dedication of both the county workers and our volunteers in the community.
You have some background in AIDS research and the application of public health toward that crisis that in some sense is obviously still out there. It's still an issue here and around the world. Any comparisons between that and what you're experiencing now? Obviously that would have prepared you for this pandemic to some degree. Maybe you can comment on that.
Right. So I think in particular, especially today, what's been so relevant has been that contact tracing is actually a tool we've used in sexual health care and preventing sexually transmitted infections for decades. One of the things that happens, a lot of people might not know, is when people are diagnosed with almost any disease that has a potential public health threat, there is a protected way that information goes from their doctor to the public health officer. And with that information, our job is to make sure we stop the spread of infections. We do the same thing for measles, we do it for whooping cough, and so now that's exactly the same tool we're using for COVID.
Yeah, that's great. I appreciate you talking about that a little bit so people really know, the depth of your background. And again, we're so grateful to have you at the county. And it's one of the reasons I think this county went from being the original hotspot to a county that really has kept things under control, especially compared to a lot of areas in the country. It's people like you and the expertise that you have. So thank you for that. Tara, are we ready to start taking questions from the public?
Yeah, so we have a question texted in, and that question is, how are we addressing the privacy concerns around contact tracing?
Yeah, great question. I know a little bit about it because they make sure all county employees, including county supervisors, elected officials, are trained in HIPAA, which is the federal privacy laws. But this is a very specific question about how do you apply all that to contact tracing, Doctor?
Right, so there are a couple of layers of privacy protections we have in place, because I think no single layer of protection is enough to really honor the privacy needs of our community. So first, there's sort of the electronic privacy, where the original information that tells us somebody has tested positive and we need to act to help protect everyone around them from spread of disease. That comes in through an electronic system into the public health department's domain through multiple layers of electronic data protection. In addition, the humans who then work that system and make the phone calls get trained in how to properly use that electronic system, and that system gets audited to make sure it's really only being used for exactly the purpose it's supposed to and for nothing else, only for preventing the spread of disease. And then finally, all of our contact tracers, both our county employees who've been redirected to facilitate this work and all of the volunteers who've come in to join the effort, get extensive privacy training, both again how to use the electronic databases correctly and share information correctly, and then when reaching out to a contact to tell them, we believe you've been exposed. We're here to offer you information, and we're here to help you get the healthcare you need and understand how to protect everyone else. We do that in a way where we do not disclose where that exposure came from, who the person you were exposed to, if at all possible. We give the bare minimum of information needed to protect someone's health.
And so when you have that conversation with someone, and we're here to follow up on a positive test, and we want to protect your privacy. What if the person on the other end of the call says, just getting down to brass tacks here, what if they say, are you going to share my information? And what happens if the newspaper calls you or somebody wants to know whether or not I was involved in all this?
Right.
Is that a concern for them, and how do you reassure them?
So we actually start off every conversation when we interview a case, someone who's tested positive, with explaining the privacy protections for their information. So we start by saying that the information that they share with us is used only for the prevention of disease and for nothing else. That means it can only be shared with other people who are directly helping to take care of them or part of that same public health system, who may be reaching out to someone who they've exposed to help notify that person. And then we address any specific privacy concerns they have. For example, none of the information we elicit is ever shared with immigration, and there's certain information we will never collect that will help people understand the difference between a scam and a real call from the public health department. That's things like we will never ask for a social security number, we'll never ask for a bank account, we'll never ask someone's immigration status, and we'll never ask for financial details or ask for payment for any kind of service we'd be offering.
Well, I'm sure that's great to know, especially in this era of so much concern about privacy, not just in the world of COVID, but
right.
It seems like with social media and everything else, people are just really worried about surveillance and whether or not that information is going to get out. So thank you.
Yeah.
Tara?
And a follow-up question to that from Peg on Facebook is, how are we doing on recruiting contact tracing volunteers or employees?
I'm really happy to answer that. We
Please
have
do.
done an amazing job. In fact, there was some subtle publications over the last week or so that hinted at how Santa Clara has frankly blown some of the surrounding counties out of the water in our ability to pull together a workforce to do this. So we are, as of today, at over 900 case and contact tracers.
Wow, that's tremendous.
It's
That's
absolutely incredible. I mean, many of the surrounding counties are sort of in the 80, 100, 200 range if they're very lucky. So that is a combination of the county really recognizing the need to prioritize this work and flexing about 400 or more county disaster service workers from whatever role they already do into supporting this effort. There are about 150 state workers who have been redirected to help us as well. And then there are over 400 volunteers from the community, some of whom have done work related to this before, but many have done nothing like this. They just came with the desire to help their community and the willingness to learn, and have come and have been an amazing asset. And so that's how we've been able to keep up with the demand of the rising case rates we've seen.
And as I recall, that's about 3 times more than what the state would even consider to be a minimum number of contact tracers.
That's exactly right.
Yeah, terrific.
Yeah.
That's great. And about double, I think when Deputy County Executive David Campos was here 2 weeks ago, we were at about 400. So great job, and another 500 in 2 weeks.
Right.
Great ramp up. Tara?
So this question is from a resident in Los Gatos, and they ask, currently the county and the state standard to judge whether or not you may have gotten COVID from someone is if you were within 6 feet of them for 15 minutes. Can you tell us more about this? Does it consider if you were outdoors with them or if you were wearing facial coverings?
Those, again, are great medical scientific questions for you, outside of my field, so please.
Sure, I'll do my best. I think, so your caller's exactly right. The standard by which we consider someone possibly exposed is if they spent 15 minutes or more within 6 feet or less of a person who tested positive for COVID. And in general, that, you can never draw an exactly perfect line. At minute 14, you weren't exposed. At minute 16, you're going to get sick. So that is an estimation based on our best understanding of the science and consensus across the state health department and the CDC. So when it comes to real people, we do use a little bit of judgment, and we know that cutoff is done with a little bit of buffer to help keep people safe. We would rather notify someone who had a very low risk exposure than miss letting someone know who could get sick and really suffer. So we do use a fair bit of judgment in that. If somebody has had repeated exposures 5 minutes at a time over and over again, we may reach out to them and say, we're worried about you too. And in general, while wearing a face mask or face covering is incredibly important to protecting someone, we often will still consider someone exposed even if both parties were wearing a mask, just to be extra cautious. There are circumstances where that may not come into play, some more nuances in other situations, but in general, even if everyone's wearing a face mask, we will reach out and notify that person is still exposed, just again, to err on the side of caution and make sure we're keeping people safe.
Yeah, it kind of explains why some of our essential workers, and I mean, service workers, blue-collar workers, are so overrepresented in the infection numbers. When you hear about the incidents that you're talking about of repeated exposure multiple times like that, that can happen when people are at work all day, and they're at a a cash register or some kind of a place where they're potentially getting constant exposure. So maybe we'll have time to talk about that a little bit more.
Sure.
Yeah, so this is another question for Dr. Rudman. I'm wondering, how are we able to reach people in an environment where they don't pick up their phones or they don't answer the door unless they know the person who's trying to reach them? How is the county conducting outreach around contact tracing and testing?
So that's another great question. I think there are a number of ways that we're doing our best to overcome that barrier of people not wanting to answer the phone. One is that we're able to send a text message just before we call to say, it's really us, the Public Health Department, we're about to call you, please do pick up. The call will say California COVID team in the caller ID. And it will be a 916 number because it's a statewide system we're using, so it looks like it's coming from Sacramento. In addition, we know that people are, probably for good reason, cautious to pick up the phone even when they see that. And so we will leave a voicemail if we're not able to reach them and have them call us back. And they can validate the phone number that they are receiving the call from by going to sccstayhome.org. So that's Santa Clara County, sccstayhome.org. Has a lot of information about what to do if you've been tested, who needs testing, what to do if you tested positive, and what to do if you've been exposed. And in there are details about what the call will look like so you can verify that it's us. So if you want to say, thanks, I'm going to check you out before I give you any information, you can hang up on us, go double check the website to make sure it's really us and you're seeing the same information, and call us back so we can talk to you.
And what if somebody needs translation? Is it multilingual at this point? Have we gotten that far yet?
It is. It's sort of in two ways we're able to address the language needs of our community. One is that we have heavily recruited among those volunteers and county workers the same folks who speak languages spoken by our community. So we have a lot of Spanish language speakers, a lot of Vietnamese language speakers, a fair amount of Tagalog and Mandarin. But we also have a language translation service sort of built into the way we call, so that if we don't know your language preference at the time we first call you, which is often the case, at the moment we connect with you and realize what language you speak, we can get an interpreter on the phone right away.
Oh, that's great. Excellent.
Yeah, and this is a follow-up to that question for Supervisor Cortese, and it's from Jose on Facebook. And they ask, what county resources are being deployed to combat the rising positive cases in the Latino community, especially in East San Jose and in zip code 95122 in particular?
Yes, thank you for that question. Last Tuesday at the Board of Supervisors meeting, the board appropriated a total of about $2 million just for outreach into the business community, the community-based agencies, and the public at large in 95122 and 3 other zip codes, including 95148, 95127, and 95116, I believe, is the other one. But the 4 zip codes that are hardest hit in terms of overrepresentation among Latinos and African Americans, and there's some areas in those zip codes where Asian community is overrepresented as well, as I recall. So there's, much like the doctor was just talking about in terms of language services when you're called with contact tracing or when you check in on the website, this is a multilingual effort, a multicultural effort that is educating, informing, and also advancing testing at the same time, increasing it even more in those areas, making it more available, and making sure people understand that it's safe, that there's not going to be registries kept or public lists of names or questions about documentation or anything else. This is, let's get you in and let's get you tested. On top of all that, there's about 3 more investments that are being made that were already appropriated before Tuesday, also to focus in on those areas. So there's a lot. I want to thank advocates, especially from East San Jose, frankly, including former Assemblywoman Nora Campos, who did an op-ed in the Mercury News one day and contacted me and said, this is unacceptable, and step it up, So we have been stepping it up, and I know my colleague, Supervisor Cindy Chavez, who's the president of our board and represents a large swath of East San Jose and those very same zip codes, has been really focused on this issue. And I thank the Public Health Department for, taking it so seriously and speeding it up. There's really been no question about that.
Susan on Facebook is asking how we're testing our unhoused. For instance, are we going to homeless encampments?
Well, I know that we are, and I know I've been pushing hard for that as well. Maybe you can give us the latest that you're aware of, Doctor.
Sure, I can tell you, I think our resources, when we think about the most vulnerable communities to impacts of COVID, both because of how quickly it might spread and how sick people might get, unhoused people are one of our absolute highest priorities. So in the Public Health Department at the Emergency Operations Center, we have a team dedicated just to investigation and support of unhoused individuals. That includes working closely with the Office of Supportive Housing, with Valley Medical Center's Valley Homeless Healthcare Program, and with the shelters and the community-based organizations that support the shelters specifically, to go out there and provide not just the same level of testing we offer everyone in the community, testing guaranteed if you're symptomatic or exposed or in a high-risk profession or high-risk situation, but additional surveillance testing in those highest risk communities, in shelters, in some of the hotels we've put together to house our most vulnerable unhoused folks, and in other places that are similarly high risk, like skilled nursing facilities.
And I understand while public health is out there doing the testing, that there's been some residual benefit, finding some people shelter. I think there's been about 700 of the unhoused that have been moved out of encampments into motel rooms that have been secured, especially for the ones who appear to be most vulnerable to COVID-19. And in addition, I know from past efforts like this that when public health gets out there and when we have doctors out there and people screening, they encounter people with other needs that can be dealt with, because our health and hospital system is basically available to anybody who's a resident of this area. They don't have to have health insurance to get help with something else. It could be a serious case of bronchitis and have nothing to do with COVID-19. But I think that's an important thing that's happening out there. If I can put my opinion out there about that. So. Tara, it looks like we have a phone call coming in.
Okay. So, what's your name? Ellen's asking, how do you become a volunteer contact tracer?
You talk to her.
Sure, I can address that. So you can go to the county's coronavirus website, which is sccgov.org/coronavirus, and then search for I Can Help. and that will take you to the website with all the information about how to become a volunteer contact tracer. I will tell you we're less aggressively recruiting new contact tracers right now because we've had such an amazing showing from the community. So there's another big piece we really want folks who want to do something to help is spreading the word about answering the phone call. I think just as one of our other callers mentioned, that reticence to pick up the phone when you don't know who's calling is still making it tough to really make sure people know when they've been exposed. And so letting folks know, however you can get the message out, that if you see California COVID team show up on your caller ID, do please pick up the phone. Absolutely verify our identity and go through the website to do so, but share the information we need so that we can help keep the community safer.
Yeah, it's been one of those little paradoxes of technology is that the smartphone has made it so easy for us to reach out to people and experience that as an elected official myself, as you can imagine. But it's also made it so easy for people to screen calls and see something that looks like a telemarketing call and just let it go to voicemail. It's probably commonplace at this point. So I think that's a great thing. We're going to be doing this for a long time. And back to Ellen, the caller, I would imagine that you're keeping, at the very minimum, keeping a bench or a depth chart of people who want to volunteer. I don't want to wish us to be doing this for a long time, but assuming that there's no vaccine until next year sometime, we could be contact tracing, we could be cycling through volunteers for quite a long time.
Right, absolutely. And so that's why we won't say no to any volunteer. We do still want to get to know you and have you come to the website, and we can work on setting up the training. We just may not have shift assignments just yet, and that's a wonderful thing. We hope it stays that way as long as possible, that we've got more volunteers than we need.
Good problem to have.
Yep.
So we have a couple people. Mike has texted, and Jennifer on Facebook has asked about testing turnaround times. And Mark's asked, where can you get the fastest tests in San Jose? And any thoughts on that?
Well, I know at the board meeting last Tuesday, a couple of us asked questions about turnaround time, and it seems like it varies depending on commercial labs or county-sponsored labs, or in some cases it sounds like there's still hospitals that are pretty slow at even getting people tested. So I understand that's, it seems like every week there's a new challenge, right? So our success has created 42,000 tests or whatever it is a week, but is that putting some pressure on turnaround time?
It is, and I think it's hard for me to represent the many healthcare providers and laboratories that are separate from the county system, although this is something that the emergency operations team is monitoring. But we are aware of significant delays to folks receiving their test results from very many different types of points of access. So I don't have a good answer for your caller about the best place to go. I can say in general that the county services the Valley Medical Center has organized has seen very fast turnarounds compared to other locations in general, but all of this is subject to change as we all struggle to access the reagents, the chemicals we need to run the tests, as well as all of the supplies. What I do think is a really important message during that time is anyone who needs to get tested because either they feel sick or they've been exposed, they should behave as if that test is positive until they know otherwise. And that's the way that you can spend that time waiting for your test result, really being as safe as possible and not doing anything you wish you hadn't done had you had that test result back faster. I know that's not a really satisfactory answer for a lot of people because we do need to get those answers and the correct lab results out to everyone as quickly as possible. But in the meantime, making sure folks are behaving as if they tested positive and really staying home and staying away from anyone else who's not already exposed is going to be really important during the period while people wait for their test result.
Well, knowing the County Emergency Operations Center, as I do, I'm sure there's people working while we speak to try to speed that process up. Obviously, I think probably the biggest hardship would be some of those essential workers that we were talking about, or I was talking about before, that are on shifts or extended shifts that are trying to figure out, should I go back to work? Should I not go back to work? If I don't go back to work, how do I explain it? Is there an excuse that I can have to let people know that they really don't want me engaging with other people while I'm waiting for this test? So I think those are all the complexities that happen in real life, right? You know, people want to comply, and I think at times people want to quarantine, and sometimes their work doesn't allow them to do that.
Right.
So we have a quick question from Anjali on Facebook, and she asks, can volunteers be high school students?
I'm not sure I know the answer to that. We may be able to find a volunteer role for high school students. I'll have to look into it. If your constituent wants to reach out to your office, I can connect with you later.
You need assistant contact tracers.
We may, yeah.
And Lawrence asks, with COVID cases going up in our state and our county, what can we do to make sure we reopen safely and reduce cases?
That's a great question. You know, I want to hear what Dr. Rudman has to say about it. Of course, you know, there's been this tension. We were talking about it before the program started today, that there's a lot of confusion about the different roles. You know, what does the city have to do with the rules about who can open and who can't? Well, not much. Cities have a lot of valuable roles. And people are dealing with the city all the time, but public health is not one of their significant roles. It's a county role and a state role, and the way the laws are set up, the county public health officer, once an emergency has been declared by the Board of Supervisors, you know, has these powers to set up these rules about who opens and who doesn't. But then the state comes in, and that's what happened recently, and the state said to some of the businesses that the county had opened up, no, we don't want you to open up because we're worried about this watch list issue. How do we deal with all that? I mean, I'm confident that your department and Dr. Cody have a pretty good scheme in place at this point. Is that going to be safe enough to open up, or do we need to be more fearful, which seems to be the state's position?
Right. I think. Again, it's a difficult, it's sort of the question. And while I have an amazing team with Dr. Cody and all of the experts she's pulled in to support her in these very difficult decisions for what type of activities are safe under what circumstances and what continues to be too risky to try to do even in protected ways. I think that's a constantly changing, constantly evolving question. So a lot of understanding whether we've made the right decision so far will come in seeing what our case rates do, what our hospitalization rates do in the next couple of weeks. And even that is not just dependent on what all of us do, what rules we set and how well we follow them, but all of the surrounding areas as well, since we're sort of part of this larger Bay Area community where we pass from county to county as family members or caregivers or workers. One of the things that will make a big difference, or at least I'm hopeful that it will, is this contact tracing effort. The idea being, if we are starting with the people who have actually already tested positive, we know they're sick, and start with the circle around them of getting those folks to know that they've been exposed to a real case, not just hypothetically, but have definitely been exposed, and to start quarantining, to start staying home right now before they even do get sick, then those restrictions are targeted just at the folks who really need it, which allows us to open up everyone else as much as possible. So again, that participation in the contact tracing, answering the call, following the instructions to stay home, following the instructions to quarantine just because you've been exposed, not even when you're sick, but before you get sick, is actually what's going to make a big difference. The other scientific reason for that is that we know with this virus, people can be contagious for days before they start to feel sick. And so that's why we want them already sheltering, already isolating before they actually get sick, at the point they know that they're exposed. And then again, the restrictions apply to as few people as possible, so the rest of us can start to head back towards the version of normal where we still continue to protect each other that I think we're looking at for months in the future.
And to get back to the basics, we both had our masks on when we came in until we got 6 feet apart. Well, I guess we were always 6 feet apart, but until we were seated. And how important is that? I mean, that's probably the most fundamental question around, and even in the country there's some debate about it. It seems like about 85% of the people I encounter amongst our constituents are convinced that wearing a mask is important, but about 15% seem to discount it or be dismissive about it. What do you say?
Right. So again, trying to keep up with the science as it's evolving, since we started from a point where we knew almost nothing about this disease, this seems to be one of the things that is very clearly demonstrated from the science. And I think what's hard to remember is that when I wear my mask, it's not to protect me, although it does do that a bit, it's to protect you. And so were we not in this special circumstance where we're sharing a conversation with the community, we'd still be wearing them just for that added layer of protection.
Right.
And the way that works is when I speak, if I'm about to get sick tomorrow or the next day, I'm already contagious. And so even that light amount, without sneezing or coughing, that light amount of spray that comes when you speak is really contained by wearing a face mask. And so I'm protecting everyone around me. So I think that's actually what's one of the things that's been inspirational to me when I see people wearing their face masks, is that they're not doing it out of fear to protect themselves. They're doing it out of a sense of community and care for those around them, because wearing these protects everyone around us.
Yeah, well said, well said.
Question online about contact tracing, and this constituent is asking what percentage of cases we've been able to successfully perform contact tracing on.
That's a great question. I can give you the most up-to-date numbers I have from a couple of days ago are that with all of the cases we're aware of that we reach out to by our case investigators, we've still been able to successfully reach 75%.
Wow.
And that is actually significantly better than a lot of other similar ventures have been able to do. And I think, again, some of that is the responsiveness of our community and the massive amount of workers we've been able to put to this important job. It can sometimes take us a couple of days to reach folks, a couple of back and forth, convincing them it's really us and getting folks to answer the call or call us back. And so we want to do even better, but I think we're doing very well. And then of those cases we talk to, when we hear from them, here are the people I may have exposed during the periods I was contagious, we're able to reach about 70% of those contacts.
And just a very basic question, how often would you keep calling someone back? We were talking about the difficulty of people letting their phones just go to voicemail, even if they're not afraid to talk or anything, they just let that happen because they're busy or whatever. What is a contact tracer told to do? Just call every hour, every day, every 8 hours? What's the typical?
Yeah, I'd say it's pretty aggressive. At the minimum, we say to try somebody twice a day for 3 days in a row before we stop trying, unless we find out that phone number is clearly not a functional phone number. And if we're really worried about somebody, if we have an emergency contact, we may try that as well.
Great, great. More questions?
Yeah. So someone has texted in, they aren't sure who they need to inform in case they test positive for COVID. And they want to know who to inform, and for instance, do they need to inform their doctor?
That's a great question. So a couple of key people to inform if you test positive. The first is, yes, it does help to let your doctor know, because that doctor can then help take care of you if you have any of the medical complications that can very rarely, but certainly does happen, cause this disease to be fatal or otherwise have serious health complications. In addition, everyone in your household absolutely needs to know, because you immediately, even before we call you, need to start isolating. And that means staying home for absolutely everything except emergency medical care. So you're not even making that protected, masked run to the grocery store or to a pharmacy. You're seeing if someone can do that for you. And you're trying your best to stay away from everyone in your household unless they're intimately involved in your care or vice versa. So if you have your own bedroom, if you have your own bathroom, try to use that, or try to be in separate rooms as much as possible. The last piece in terms of who to inform is, don't wait for us to call you. If you know who you've been in contact with, at least starting 48 hours before you started to feel sick or 48 hours before you tested positive, whichever came first, do go ahead and let those people know they've been exposed. It can take us a little while to get to you, just as we talk, to reach somebody, and there's absolutely no harm in going ahead and letting somebody know right away. But with all of those instructions I talked about for somebody who has to stay home, we appreciate that's not easy. That can jeopardize people's income or their jobs or their sick leave. Not everyone has a way to get groceries delivered or a way to get medicines delivered, and the county has supports for all of that as well. And so on that same website, sccstayhome.org, you can see information for how to access all that assistance.
Yeah, that's very reassuring, and people should not be afraid amongst the people they let know right away, to let their boss know, to let their employer know. I think oftentimes there's fear out there, but then what? What if I get sent home on, unpaid time off? what if I don't have any PTO left or vacation time or sick leave left? I have to feed my family. We've heard stories about, and not around here, but packing companies, actually some food processing places even here, where employees claimed that they really felt under pressure to keep showing up to work. Call the county, call us. We have an Office of Labor Standards Enforcement that's also tied to the EOC. We have people like county supervisors that can help you get relief. There's something at the federal level called the Family Leave Act, which has been expanded to allow some more paid time if you have direct COVID impact like that. So the point is, don't be afraid. Just keep pushing and keep asking and informing and asking for information.
Yeah, so Veronica on Facebook, Veronica's from Milpitas, and she's wondering about rent relief that the county has been working on, and she mentions that many families are struggling to pay rent and pay their taxes, etc.
Yeah, this is a huge issue, and I'm glad we're talking about it because it's been a little bit under the radar. We've certainly had landlords and tenant advocates and even public interest law firms talking to us at the Board of Supervisors, coming to us on Zoom conferences, on phone meetings, saying, look, this is kind of a train wreck that we're heading into. And we understand that because people have been, a lot of people have been unable to pay full rent. And because of that, the county issued a moratorium on evictions. But that doesn't mean that people don't have to pay their rent. It just means they can't be kicked out. Meanwhile, if they aren't paying their full rent, the landlord's struggling as well. A report was just issued by a group called Working Partnerships here in Santa Clara County late this week, which made a compelling case that we are on the brink of having about 55,000 folks just on the renter side. This isn't even including people who might be struggling with their mortgage payments, but renters, over 50,000, who are on the brink of homelessness or essentially of default. They can't pay their rent right now, July of 2020. And obviously we have a long way to go yet, by all accounts, in terms of dealing with this pandemic. So the county is doing two things. We're lobbying really, really hard to get something passed in terms of a new stimulus bill called the HEROES Act by Congress, and hopefully this president will sign that, which would get, among other things, a lot of money to counties, and a lot of that money, at least as written currently in that bill, would be available for mortgage relief, rent relief, to help both landlords, tenants, banks, and mortgage payers. But the problem is so huge, I'm going to be very honest with everyone, it is so huge that there really are few cities and counties in America that would have the wherewithal to pay the rent for 50 or 60,000 people or more for any length of time. It's just a huge amount of money. I would propose at some point that we're going to have some kind of a mediation program set up that starts working out payment arrangements between landlords and tenants before people end up out on the street. And I'm sure that that'll be something the Board of Supervisors in this county works on very hard. I know I'll be trying to play a leadership role in that regard.
Yeah, so someone has texted in, when someone with COVID is admitted to a hospital, are contact tracers automatically alerted, or does that person need to reach out to find a contact tracer? And Evangeline online has asked, what's the coordination between our contact tracers and our hospital system?
Well, that's all your department.
Sure, another great question. So all hospitals or diagnosing doctors of any COVID case, they are required to report those cases to the public health department so that we can begin the contact tracing process. That said, there does sometimes occur a delay between when a diagnosis occurs or someone's admitted to the hospital and the public health department is aware and can begin contact tracing. So it is still helpful for hospitals to go ahead and reach out to the public health department, and they have routine means of doing that when they're aware of a case, if they can facilitate notifying specific contacts. But in general, we're working very closely with our hospital partners on all of this work.
Great answer. Tara, how are we doing with questions? If
Yeah.
you run out of questions, I have lots of questions for her. Just let me know.
So this is it's sort of a bigger question, but Todd has asked what we think about medical experts saying the country should shut down for a few weeks to battle COVID.
Yeah, it's been an interesting policy question, of course, on the side of the organization that I'm on, right, where we make rules and policies that are more generalized. That, you know, we've seen in dictatorships or very centralized government entities, even if they're in democratic type governments, where there's a strong central national government effort, which we haven't had much of here lately, especially with regard to COVID. But where we've seen that, there's also been some success in doing even more severe lockdowns, but for shorter periods of time, so to speak. In other words, let's just lock everyone down, sort of contact trace and try to disrupt the virus and contain it, and then get back to opening up for business. I don't think that can happen here the way we operate in a democratic society with all these counties having, you know, their own say in things. I think the question is there medical validity in that kind of an approach? Is it, or is it kind of a myth that people have had success with that?
Right. I'm not sure I know the evidence from nation to nation or location to location about which types of lockdowns have made the biggest difference, because I think, exactly as you said, applying that to Santa Clara County might look so different here that it would really not translate. So I think, again, we've really struggled with these questions of how to balance prevention of transmission by universal rules that lock everyone down versus individual recommendations from sector to sector. And I think that's a tough balance, especially knowing that COVID is not the only killer out there, that the resulting poverty or the resulting struggles with rent or the inability to have social interactions, those cause negative health effects as well that we're very aware of, and balancing those is exactly what Dr. Cody and her team sort of think about all day, every day. So yeah, I think knowing whether right now for this county more aggressive lockdown is the right decision is not something I know specifically, but I do know that the right people are asking that question over and over again every day and looking at all of the possible solutions for it.
Great, thank you.
This is our last question, and it was from the caller earlier, and you addressed this a bit before, but a couple people have still asked, how can we make sure people take wearing masks seriously?
I think we're just going to continue to step up the information campaign. I think the question asked here, where we can answer the question and reach a few thousand people, helps. Every time we do that, it should be helping. Somebody started a campaign about another issue recently, a member of the Oakland Athletics baseball team. I heard about it yesterday, which is called the Plus One campaign. It's just this idea that if everyone would not only tell somebody, but plus one, add another person to your conversation circle if you believe this is important, because the vast majority of people are taking it seriously, and sometimes it's neighbor to neighbor influence. I kind of call it positive peer pressure. I'm gonna give you the last word here. Maybe you can, instead of pressure, you can let people know what good has been happening, out there, and how important it is for everybody to keep complying.
Right. I think we were talking a little bit earlier about how I stay optimistic throughout all of this, and I think we happen to live in a place that has done some amazing things one after another in the face of something terrible. So thinking about wearing masks is just one of those. It is both required by law now, and so when you're outside of your home and anywhere where you might come into contact within 6 feet of someone or entering another indoor location, it is required. But I think for most people, it's not that legal impetus that makes the difference. It's it becoming normal. And so the most important thing I think any one of us can do to convince others to wear their mask is wear our mask. I thought about it today. I went for a walk where I was more than 6 feet away from people for the entire time, but I wore it anyway, just thinking everyone seeing me is getting used to seeing one more person in a mask. And I'm also having a little fun with it, as much as people want to show their personal styles with something that makes them feel good to wear. But I think it's the hope I have that people will translate that same same generosity, same caring for each other that we've seen in the way this county came together to shelter as early as we did, the way we flattened the curve in hospitalizations in a way that almost no one struck as early by the epidemic did, the way we did. I think that same generosity of spirit, I think that same interest in science and care about what is recommended based on good information is going to continue to carry this community through and going to make changes like getting people to wear their masks as well.
Well, Dr. Sarah Rudman, thank you so much for everything you've done. I can only imagine the personal and professional sacrifices you've made over the last 4 months. I think people in the community get that there are folks like Dr. Rudman, who you just heard about, who also she has a family, she has obligations, and she would like to have her full life back too. But thank you so much for turning all your attention to this pandemic and keeping people in Santa Clara County safe. We've been trying to deal with it one county at a time, and it's people like you that have made that work for now. And to all of the folks that are listening in, we're putting our masks back on now. Please do the same if you head out, and keep them on all weekend. And if we can keep these masks going for a couple more weeks, I'm confident that we'll get off the state watch list and we can all go get a haircut. Thank you.
Thank you.